Thank you so much for joining us. I am here with Dr. David Walmer from the Atlantic Reproductive Medicine Specialist Fertility Clinic out in Raleigh, North Carolina. And this short podcast, we discuss the various things on what to look for when looking for a fertility specialist or fertility doctor when looking to start building your family. There are tons of doctors out there that offer this service. The Atlantic Reproductive Medicine specialists focus on a very high touch, very engaging approach to fertility treatment and care and achieving the family that you desire. In this podcast, Dr. Walmer shares with us some of the most important things to look for, some of the questions to ask from when looking for your fertility specialist, and helping you to achieve a healthy pregnancy, and then a little bit more about the various natures of preconception counseling and the importance of that. One of the things that stands out about Atlantic reproductive medicine specialists is that they focus on not just achieving a healthy pregnancy, but the overall experience, mind and body, and making sure that the way that you achieve your pregnancy and build your family is in line with your values. Um, so let's get started. Dr. Walmer, thank you so much for joining us once again. Could you please just give us a overview and an idea of what to look for when looking and starting the journey to get pregnant for couples today?
Well, I think that you're looking for a number of different things. Number one, you're looking for someone who's trained to deal with this specialty, but you also want someone who's going to spend time with you, get to know you, and not only your situation but your values. And then somebody who's not going to pigeonhole you based on what they think you need to do, but to actually give you options so that you can apply your values. And that can change over time so that you can develop a strategy that deals with your values and where you are at any given time in your care.
Right. So what kind of questions would I ask to kind of understand if they are going to kind of respect my values and things like that? Is there a certain way to ask them, or what would you recommend?
Well, I mean, one thing is, a patient may want to know what factors are specific to them that may influence their probability of conception. And as they get the options, then they have and when you talk about options, you talk about what is the probability of success, what are the potential risks, and then what is the investment in that. And that investment is time and money and sometimes the psychology of the frustration from if they've been repetitively not having success, so that they can then understand how to apply their values based on those criteria.
Gotcha. Are there any red flags that I should be aware of or that we should know about?
Well, I think it depends. Patients will frequently start. They oftentimes come to us via a primary care provider, whether it's a family practice physician or an obstetrician gynecologist that provides most of their care. And many of those docs can provide good early data, but I think as you advance into the reproductive endocrinology field, I think what you really want is someone who's board certified. And one of the questions is to a patient is like, how would I know if my doctor is board certified? And they can actually go on to the American Board of OBGYN's website, and there's actually a little tab there that says, check the link. It says, is your doctor board certified? They can put in the doctor's name, the state they're from, and it'll tell them whether they're board certified in OBGYN, or it'll say they're board certified in OBGYN and in the subspecialty reproductive endocrinology and infertility. So they can actually do their homework and find out what their physician's credentials are.
Oh, okay. And how would I know it's time to kind of call a specialist? You mentioned that there usually people are recommended through a a primary care physician. But what if I kind of just had a feeling that I would need a fertility specialist? How would I know when to call someone?
Well, I mean, different people have, we'll get to that at different times. When it comes to your OB care, I mean, we've got some patients that, even though they're low-risk doctors, they want to be followed by high-risk obstetrician. And the idea is, well, if anything does happen, I don't have to change my doctor. I'm already there. And I think the same thing is true in our field. A lot of them have great relationships with their primary care docs, and they'll just follow along there because that relationship is so good until they advance. But other patients want to get that subspecialist opinion all the way back to a preconception counseling session. Say I want to prepare for pregnancy so that I have a heads up on any potential risks, and I want to get into a pregnancy with the highest probability of getting pregnant and minimizing complications in that process. So you might go to preconception. If a woman knows she has a problem, then there's absolutely no reason to wait. But if she doesn't know, as far as she knows, there is no problem, then I would say, if a woman is in her 20s, early 30s, and she's comfortable, not pushing it, they can try for, 6 months to a year. If a woman gets into her late 30s, she may want to start getting some counseling even after she tried 3 to 6 months. Because the probability, the average age women show up not thinking they're going to have a problem, and it's taken longer than they expected, is when women are sort of in that 34 to 36 window. So it doesn't hurt to go and just get some basic questions answered. Are there sperm? Are there eggs? Can they find each other? Is the uterus a good place for a baby to be?
And how long is preconception counseling? How long does it usually last? Is it kind of a one-time thing, or is it ongoing?
No. I mean, usually, what you can sit down. I mean, we usually spend about an hour with our patients the first time they come through, and what we'll do is we'll help them understand human reproduction. And a lot of people don't realize that humans are actually habitual aborters by nature, and the average length of time it takes for a young woman who has no problem to get to a positive pregnancy test is about 4 months. And we used to think that was, not pregnant, pregnant. But what we now know is that's actually unrecognized miscarriage, ongoing pregnancy. And so there's teaching them a little bit about human fertility, some of the factors, some of the things you can sort of anticipate. We can do genetic testing for autosomal recessive genetic disorders that would never have shown up with a family history. So you can prevent things like cystic fibrosis, sickle cell disease in the African American community without just by doing some basic blood tests. And so there's things that people may not think about that would help them have a healthy pregnancy. Or they may have, a subtle fertility problem that they may not even be aware of by going through that preconception counseling.
What would you say is the most important thing for a couple who is looking to work with a fertility specialist needs to know and remember prior to beginning their journey to building their family?
Many times, even though a patient has an OB, if they're having trouble, they bypass their OB and they come directly to us. And what patients don't think about sometimes is the fact that what we do for a living is we create problems that other physicians take care of, because we're only going to help a woman get pregnant and follow her through about 7 or 8 weeks, and then her OB doctor takes care of her from then on. So if we identify risk factors for pregnancy, hypertension, diabetes, then we want her to go back and meet with her OB, make them aware that that they're trying to get pregnant. So if they want to tune them up a little bit to minimize the chances of complications in pregnancy. That the thing is that we want the patients to realize that we are a team with their primary care OB.
Gotcha.
That we're going to help them get there, but then we're going to pass the baton off, and the other physician is going to follow them through the 40 weeks gestation delivery mode, and we want both parties to be working together. And even once we've helped them get pregnant, we're going to follow them, not taking care of them, but they're part of our family, and so we'll want to follow them out. But we really want their OB engaged from the beginning.
Are all OBGYNs able to help do the initial testing to determine if a couple is facing fertility challenges? And where exactly would an OBGYN fit into the puzzle when working with you or a fertility specialist to achieve a healthy pregnancy?
There are some general OBGYNs that like fertility, so they do more of it, but they're not really subspecialty trained to do that. So I think that at some point in time, if things aren't working, and in that formula mix of options is going to be some of the higher tech things like IVF, or using some of the drugs that have higher risks, then I think it makes sense to seek out a subspecialty person they have their general boards, but they're subspecialty boarded in fertility, not just a generalist who is interested in practicing that.
You are in Raleigh, North Carolina, which would essentially be, considered the leader and the innovators of fertility treatment. What would you say to couples looking to build a family with the vast options out there? What's the best way to choose, and how do they navigate this important journey?
But this area is very rich in patients are very fortunate to have a number of good programs, and they have some very unique aspects. There's 2 university programs, and in those settings, it's going to be a very academic atmosphere with active learning going on, and those young doctors are definitely going to be keeping up. If it's important for a patient who says this is a really sensitive thing and I don't really want learners in the room, that's something they may want to consider. Some practices are very, very busy, and so they're not going to have as much time with the provider as they might with somebody who's intentionally maintaining a lower volume practice and spending more time with patients. So I think that really patients can tailor what it is they want to get out of it to the different practices and the providers, and that they can partially do that by asking their primary care doctor for recommendations based on their values, or they can go and just have the experience and see, is this what I want? And understanding that there are different practice styles.
One of the biggest decisions that you will make when looking to build your family is how you do it, and understanding your options and what you can do and what's available to you, connecting with your fertility doctors to make sure that your values are protected is essential. Thank you so much, Dr. Walmer, for taking time to speak with us about how to choose a fertility specialist and what to look for. We highly encourage you to visit the website mentioned here to determine whether or not your fertility specialist is board certified. There are many options in Raleigh, North Carolina. Please visit atlanticreproductive.com to learn more about Dr. David Walmer at the Atlanta Reproductive Medicine Specialist Fertility Clinic located in Raleigh, North Carolina. Thank you, and we look forward to taking up some more questions that you have here in the near future. Take care.